More and more Ohioans are dying from drug overdoses.
Worse than ever. And COVID was like gasoline on the fire.
In fact, there were a record-breaking 5,100 unintentional overdose deaths in Ohio in 2021. This all comes as the makers and distributors of opioid painkillers are starting to pay Ohio more than $1 billion from lawsuit settlements. Today, the nonprofit responsible for distributing that money, the OneOhio Foundation, named Alicia Nelson its new director. Nelson most recently served as director of Humana Healthy Horizons Ohio. So tonight, News 5's Clay Lepard takes an in-depth look at the OneOhio Foundation and what's next in tackling this opioid crisis.
How many decisions does one make in a lifetime? 1,000, 1,000,000, maybe more? Somehow between the big ones and the little ones, Keith Hohodl made it his life mission to prevent the wrong choice he made 30 years ago.
About 93, I hurt my back moving railroad ties. Had my own pharmacy, so I took a couple Vicodin and I was off to the races.
An addiction that didn't cost his life, but instead his livelihood and his family's love.
In 3 short years, it took everything that I had away from me. It took my family, my business, the lifelong career that I wanted.
Inside this transformed Canton church, he runs a nonprofit helping others find a job. He's also on the board for the OneOhio Foundation, the volunteer-led, state-created, newly privatized nonprofit responsible for distributing the growing bank account of opioid settlement money. The money injected into Ohio comes from 10 different companies that settled opioid lawsuits over the past several years. The OneOhio Foundation is expected to see about 55% of the pot, or nearly $1 billion, with 30% going to local government and 15% going to the state.
We're going to have a yearly distribution of funds. There'll be a yearly grant process.
Judge David Mattia sees what works and what doesn't from inside his drug court in Cuyahoga County.
How long were you using?
But this board member knows what works in Cleveland may not work in rural communities. That's why he says the foundation will support all sorts of ideas from different regions in the state, whether that's rehabilitation, access to transportation, or other forms of support needed to survive.
It's a nice opportunity to advance on our thinking on this. On the other hand, we're looking to fund evidence-based programs. This is not going to be cotton candy for people in recovery and acupuncture.
It's a lot of money.
Much of the money spent so far,
All in favor signify by saying aye.
Has gone towards building the infrastructure behind a $1 billion entity, but not without controversy. Over its first year of existence, the foundation faced lawsuits regarding transparency and making records public. It was told by the Ohio Supreme Court it had to comply with those requests and responded by adding an amendment to the Ohio budget, turning itself into a private nonprofit.
It was designed to be an innovative approach to help our state put this important mission above politics and free from bureaucracy.
So they say they want to free themselves about politics. However, the board is all politicians.
Dennis Kushon leads Harm Reduction Ohio and spearheaded the lawsuit against the OneOhio Foundation.
The money can be put to good use, and that the impacted population needs to be welcomed to the table and have a voice at the table. It's their money. This money is literally paid as compensation for deaths. And the people who have lost loved ones have no representation in how the money is being spent.
The reason for the foundation's nonprofit status, the board says, is to avoid what happened when the state settled with Big Tobacco in 1998.
Cigarette smoking carries health risks, and for my own daughter, I hope as an adult, when she makes up her mind, that she decides not to smoke.
Back then, legislators diverted much of those funds away from tobacco prevention and instead put them in the state's general fund.
When I got appointed to this, I thought I was going to have a front row seat at the wasting of the tobacco, or the wasting of the opiate money like the tobacco money went.
It's important that this works the way it's designed to work, that the strategy to get the dollars and the resources out gets it out without somebody coming in, without state government coming and taking that money back and finding other uses for it.
Board members hope to open up the grant submission process as early as this fall, distributing the first round of funds in the spring of 2024. A new series of decisions with the potential to change how addiction is confronted and handled in Ohio.
Let's face it, what we've been doing hasn't worked very well.
In Cleveland, Clay Lepard, News 5.